Hi, before we start this ASMR video, I'd like to thank all these members on my Patreon for their continued support. If you're looking for any content that I create on other platforms, check the link below. Now, let's get into the video. Thanks for coming in on such short notice. It's imperative that we do this cranial nerve exam to you as soon as possible. I've got my tools here, but I just need to confirm with you before I go ahead with anything. Just to make sure I have the right person here, and I am a little bit old school with my notes. Your name? Date of birth? Do you know your weight? Oh, excellent. And your height? Perfect. I won't delay any further getting into this exam. I'm going to be going through your cranial nerves 1 through 12. Have you had a cranial nerve exam before? Good, so you won't know anything that I'm doing. So just follow my instructions and listen to me. We'll start with your cranial nerves, number 1, which is your eyes. And I do apologize. I've left my pen just over there on my desk, my pen light. Just need to grab it. Sorry about that. Cranial nerve number 1, 2, 3, and 4. I'm going to be looking at your eyes. I'm going to be getting you to do a variety of sequences where you move your eyes in certain ways. Just follow along with what I ask. Good. I'm just going to get a little close to you now, and I'd like for you to look up for me, please. Keep looking up. Good, let's look in the other eye. Keep looking up for me. Any issues with seeing lately? Any double vision, blurriness, stigmatisms? Do lights look like they are a little bit more blurry or like have these aura? No. Good. Look down for me. Thank you. Just keep looking down. The other eye, keep looking down. Good. Can you look in that direction, please? Thank you. Good, I'll look at your other eye now, see which. Good, look the other way, please. Great. And then this eye. Good. Well, your eyes seem okay. I'm just gonna lift up your eyelids, and I'd like to just have a peek at myself, so just stay still for me. Look to the left. Good, and then now look to the right. Look down for me. Just look down, thank you. To the side. To the other side. Good. How many fingers? Good, and how many fingers now? And now, as I get closer, do the fingers become blurry, or do they focus? They focus, good. That's good. I'm just going to cover your eye, and I'd like for you to tell me if you can still see me with the other eye. This is removing your depth perception. Just tell me if I look closer or farther away. Closer or farther. Closer or farther. Good. When I cover both eyes completely, is it dark? Can you see anything? Good. This next side has little holes perforated in it. Let me know if you can see me just a little bit. Can you see me? Can you see me? Good. Can you see me again? nose, touch my hand. Touch your nose, touch my hand. Touch your nose, touch my hand. Good. I'd like for you to do that again while covering one of your eyes, and you're going to touch my finger. You're going to touch your nose and touch my finger now. Cover one eye, either one, and then we'll do the other one. Alright, and nose to finger. Nose to finger. Nose to finger. Nose to fingers. Sorry about that. Let me adjust my light here. It seems to be a little bit, it's too yellow in here. I need to get some fluorescent. It helps me see into your eyes better. Just bear with me. There we go. Much better. Again, follow the finger, touch the finger, touch your nose. Finger, nose, finger, nose, finger, nose, finger, nose, finger, nose, finger, nose. Good. Was that difficult at all? Great. So far, I'd say your cranial nerves 1, 2, 3, and 4 are fine. No issues with your eyes. I'll be going through cranial nerves 5, 6, and 7 now. Those are going to be your ability to push and pull. Backwards there. Pull and push. Along with your shoulders in terms of shrugging up against me. Perfect. So I'd like for you to put your arms up like this. Make a fist. I'm going to grab your arm and I'm going to pull it away from you simultaneously with both hands. I would like for you to resist. Try and pull the palms of your hands close to your face, like you're going to punch yourself in the face. I won't let that happen, but that's what you're trying to do. So, arms up like so. I will grab them, and I will tell you to resist in a second. And 3, 2, 1, and resist, 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 resist. Good. I'm going to let go now. I didn't feel any general weakness in either your left or your right arms there in terms of pressure. That means cranial nerve 5 is working. I'm going to be pushing against you now. So you're trying to let me not get your fist in the face. I'm going to push against you. Again, I will count it down. And then you will resist as I push in. So arms up again like so. And resist, 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 resist. Keep resisting. You're doing great. Good. I'm going to let go. No general weakness was found in your left or right side there. So, cranial nerve 6, good. We're going to be doing cranial nerve 7, which is your shoulders. Your shrugging motion. I'm just going to get you to push up while I push down. Alright. And 3, 2, 1. Resist, 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 resist. I'm going to let go now. And good. Sorry about that, I have quite an itchy nose. Now, that's cranial nerve 6 and 7. Cranial nerve 8 is in your mouth. So, let's get these gloves on here. use the soft piece. You just let me know if it's hard or soft when I prick you with this object, okay? Good, and here we go. Hard or soft? Good. Hard or soft? Just doing key points on your face. Hard or soft, let me know. Good. Again. Hard or soft? Good. 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 Any difficulties with that? You could tell the difference between something that is sharp and soft, right? Good. Apologies for that. Seems that my notepad was not on silent. Just my agenda saying I have an appointment soon with another client. So I will now be doing cranial nerve. That was 9, 10. This is where you're going to close your eyes. You're just going to tell me if you can feel specific areas that I'm touching your face. So, close your eyes. Good. Can you feel that? You just say yes on certain areas. You felt all those areas, right? Good. Let's listen to your heart quickly before we do cranial nerves 11 and 12. Like for you to take a deep breath, please. Let's just listen to your heart here. Good. And again. And again. One more time. Good. I'd like for you to say the words 99 on your backside, please. And go. 99, yes, I'll say it with you. 99. 99. 99. 99. 99. 99. On the front of your chest now. And 99. 99. 99. 99. Deep breath in for me, actually, please. I'll do it with you. Deep breath in. Let it out. Good. No issues there either. Just bear with me for a second here. Just writing these down, my old age, before I forget. Good. Let's do cranial nerves 11 and 12. This is speech and cognitive memory. Can you say the alphabet for me? You don't have to do the full thing, that's okay. Can you say it backwards? You can take your time on this one. Good. Great. Okay, you don't have to do the full thing. That's excellent. You've done fantastic there. Next, I'm going to tell you a variety of words. Then I'm going to do letters and then colors. Different times. Repeat them back to me. Blue, orange, yellow, red. Blue, orange, yellow, purple. Good. What was the first set of 4 that I gave you? Good. Now, 1, 6, 8, 3. 1, 6, 8, 7. 1681. What was the second one that I gave you? Do you remember that one? Let me just cancel my appointment here. Good. Do you remember the next one? The second one? And do you remember the first? Good, good. So, that's cranial nerves 11 and 12. I don't see any issues that you're having throughout any of those varieties. If you feel any differences come up over the next months or so, please, by all means, call my office. Come on in. You know where to find me. I'm always here and willing to help my patients feel